Welcome everyone to the podcast. Today we're diving into something truly essential for primary care physicians, and that's dermatology. Specifically, we're going to talk about a fantastic series of masterclasses from the London Dermatology Centre that are really making a difference for busy GPs. I'm incredibly excited to be joined by Dr Sunil Chopra, the visionary CEO and founder of the London Dermatology Centre, and Dr Abirami Pararasingam, a brilliant dermatology consultant who's leading their next vital session. Sunil, Abirami, welcome.
Thanks, David. It's a pleasure to be here and chat about these masterclasses. They're really a passion project for us, born out of seeing a real need in the primary care community.
And I'm thrilled to be involved, David. The feedback from the previous sessions has been so positive, and I'm looking forward to contributing to this vital area of skin cancer detection.
That's fantastic to hear. Sunil, let's start with you. The London Dermatology Centre has really stepped up with these fortnightly hybrid masterclasses. What was the driving force behind creating them, and what's your overall vision for supporting busy GPs?
Well, David, it's pretty simple, really. As dermatologists, we often see patients who've been struggling with skin conditions for a while before they get to us. And it's not because GPs aren't doing their best, they are. But primary care is incredibly demanding. GPs are managing so many different conditions, and dermatology, while common, can often feel like a specialized area where quick, confident decisions are hard to make without very specific, up-to-date knowledge. My vision was to bridge that gap, to empower GPs, to give them that extra layer of confidence and knowledge, not just in recognizing skin issues, but also understanding their associated comorbidities.
That makes so much sense. I can only imagine the sheer volume of different conditions a GP sees in a day. Dermatology can sometimes feel like a niche, yet it's something almost every patient will present with at some point, right?
Exactly, and it's not just about common rashes. We're talking about things that can significantly impact a patient's quality of life, or even be life-threatening, like skin cancer. The early recognition of these conditions can make all the difference. So we designed these masterclasses to be practical, focused, and truly beneficial for a busy GP's daily practice. We wanted to make learning accessible, which is why we offer them in a hybrid format, in person at our Wimpole Street clinic here in London, which is great for networking, and online for a global audience.
The hybrid approach is genius, really catering to everyone's schedule and location. And you mentioned networking, that's another huge benefit for those who can attend in person. Getting to meet fellow GPs and your expert consultants, I imagine that's invaluable.
Absolutely. It's not just about the formal learning, it's about building a community, sharing experiences, and having a direct line to ask questions to specialists. We've seen some fantastic discussions emerge from those in-person interactions. And for those who can't make it to London, the online option ensures no one misses out on this crucial information. We're also building a comprehensive video library of all these archived masterclasses. The idea is that these sessions will be a living resource. If a GP misses a session or wants to revisit a topic, they can access it on demand. It becomes this incredible educational repository for ongoing professional development. Imagine having a curated library of concise, expert-led dermatology modules at your fingertips whenever you need a refresher.
A video library, that's a game changer. So it's not just a one-off event, it's an ongoing resource that GPs can tap into anytime, anywhere. That truly reflects the busy GP focus you mentioned. Now let's talk about this specific upcoming masterclass. Dr Abirami, you're leading the session on dermascopic clues and clinical pearls in skin cancer detection. That sounds incredibly important. Can you tell us more about what GPs can expect from this masterclass on November 13th?
Yes, David, I'm really looking forward to this one. Skin cancer detection is an area where early intervention is absolutely key. For GPs, who are often the first point of contact, recognizing potential melanomas and other skin cancers can be incredibly challenging. There's so much variation in how they present, and frankly, a lot of what's taught in general medical school might not be enough to feel truly confident in a busy clinic setting. This 1-hour CPD accredited session is designed specifically to boost that confidence.
So what are some of the key takeaways you're hoping GPs will leave with after your session?
Well, first and foremost, we'll be diving into how to recognise the varied clinical presentations of skin cancer. It's not always the classic ugly duckling mole. We'll look at different types of melanomas, nodular, superficial spreading, lentigo maligna, and what subtle signs to look for. We'll also cover non-melanoma skin cancers like basal cell carcinomas and squamous cell carcinomas, which are far more common but can also be tricky to distinguish from benign lesions.
And the dermoscopic clues are really what elevates the detection. It's about looking beyond the naked eye, isn't it, Abirami?
Precisely, Sunil. A dermatoscope is such a powerful tool in primary care, but knowing what you're looking for, those specific patterns and structures, is what makes it truly effective. We'll go through practical visual examples to make that really clear. Beyond recognition, we'll also explore the understanding of comorbidities and their impact on quality of life. For example, patients who are immunocompromised or those with certain genetic conditions might have a higher risk or atypical presentations. Understanding these underlying factors helps GPs make more informed decisions about screening and management.
That's a critical point. It's not just about the skin lesion itself, but the whole patient picture. And what about management and referrals? That's got to be a common pain point for GPs, knowing when to treat in-house and when to send to a specialist.
Absolutely. We'll cover practical approaches to management in primary care, what a GP can confidently do, and what they absolutely should refer for. Crucially, we'll detail when and how to refer for specialist input. What information is vital to include in a referral? How can you ensure the patient gets seen by the right specialist in a timely manner? We'll make that process much clearer. And of course, the field of dermatology is always evolving, so I'll be sharing the latest updates on advanced and emerging treatments, giving GPs a comprehensive overview of the current landscape.
That's incredibly thorough for a 1 hour session, and I understand there's an interactive Q&A component as well, where GPs can bring their own questions and even real-world cases for discussion. That sounds incredibly valuable to get immediate expert feedback.
Yes, that's one of my favourite parts. It's not just a lecture, it's a chance for GPs to engage directly, to challenge me, and to get answers to the specific, sometimes tricky cases they've encountered. It really brings the learning to life and makes it immediately applicable to their practice. Those discussions often highlight common dilemmas and provide practical solutions that resonate with everyone in the room or online.
That interactive element is really central to our philosophy, David. It's not about us just dictating information, it's about a collaborative learning environment. When GPs can bring their real-world scenarios, it helps personalize the education, making it incredibly relevant and memorable. And honestly, it often teaches us something too. It's a two-way street.
I can see that, and with it being CPD accredited, time efficient and so focused, it really does seem like the perfect opportunity for busy GPs to enhance their dermatology expertise without disrupting their entire schedule. So just to reiterate, it's on Thursday, November 13th from 6 to 7 p.m. UK time.
That's right, and whether you join us in person at our beautiful Wimpole Street clinic or participate online from wherever you are in the world, you'll get the same high-quality content and the opportunity to interact.
Sunil, what would you say to a GP who's maybe on the fence about attending?
I'd say honestly, this isn't just another webinar, it's a targeted, expert-led session designed by people who understand the pressures of primary care. The ability to more confidently detect skin cancer, to understand the subtle clues, and to know precisely when and how to refer, that's not just good for your practice, it's potentially life-saving for your patients. It's about feeling more secure in an area that can often cause a lot of anxiety for both patients and clinicians. And it's only an hour out of your busy schedule. Think of the impact that hour could have.
That's a very powerful message. And Dr Abirami, any final thoughts for our listeners, particularly those busy GPs?
Just that skin cancer rates are unfortunately still rising, and the more confident and skilled GPs are at early detection, the better the outcomes for everyone. This masterclass is truly designed to be practical. You'll walk away with actionable insights that you can implement in your very next clinic. Don't miss this chance to refine those crucial skills.
So there you have it, straight from the experts, the London Dermatology Centre's masterclass on dermascopic clues and clinical pearls in skin cancer detection with Dr Abirami Pararasingam on Thursday, November 13th from 6 to 7 p.m. UK time. If you're a GP looking to enhance your expertise, build your confidence and network with peers and specialists, this is an invaluable opportunity. Places for the in-person session at the London Dermatology Centre clinic in Wimpole Street are limited, so we highly encourage you to register as soon as possible. And if you can't make it in person, the online option ensures you won't miss out.
Please do join us, whether in person or online. We're really looking forward to sharing this vital knowledge and supporting you in your practice. You can find all the registration details on the London Dermatology Centre website or check out our Eventbrite page for the Masterclass series.
We hope to see you there. It promises to be a very enlightening and practical session.
A huge thank you to Dr. Sunil Chopra and Dr. Abirami Pararasingam for joining us today. And thank you to all our listeners for tuning in. Make sure to register for this essential masterclass. It could truly transform how you approach skin cancer detection in your practice.